Hey everyone, and welcome to another episode of CyberMD. Thanks for tuning in. Today, we'll be discussing the topics of rate, rhythm, and axis of EKG tracings. This is crucial for the USMLE Step 1 exam and will be extremely important for some specialties such as cardiology, family medicine, and emergency medicine. Let's start by quickly assessing what the boxes on an EKG tracing mean and what some of the normal interval times and complex times are. On an EKG, each small box represents 0.04 seconds and each large box represents 0.20 seconds. In other words, each large box consists of 5 smaller boxes. This information is especially important when interpreting the duration of the QRS complex, the PR interval, and the QT interval. The QRS complex represents the depolarization of the ventricles and should normally be less than 0.12 seconds. The PR interval represents the time from the beginning of the P wave to the beginning of the QRS complex and should normally be between 0.12 and 0.20 seconds. The QT interval typically ranges anywhere from 0.35 to 0.46 seconds and is the time from the Q wave to the end of the T wave. Now, let's talk about heart rate. The rate is the number of heartbeats per minute, and there are a variety of ways that you can determine this. The rate is sometimes determined by counting the number of QRS complexes in a 10-second interval and multiplying by 6. Thankfully, a standard 12-lead EKG rhythm strip, which is the longest strip at the bottom of the paper that runs the entire length of the EKG sheet, is 10 seconds long. So you can simply count the QRS complexes on the rhythm strip and multiply by 6. The normal heart rate for adults is between 60 and 100 beats per minute. A heart rate that is too fast is known as tachycardia, while a heart rate that is too slow is known as bradycardia, and these can indicate problems with the heart's electrical system. You can see here on the EKG shown on the slides that there are 14 QRS complexes in the rhythm strip. This means this patient's heart rate was at 84 beats per minute when this EKG was taken. Another way to estimate the rate is the 300 rule. In this rule, you jump from big box to big box. The first jump represents a rate of 300 beats per minute. So if you have back-to-back QRS complexes that are on adjacent large boxes, the heart rate is 300 beats per minute. From the first large box to 2 large boxes over is 150 beats per minute. This is 1/2 or 1/2 of 300. This pattern continues in which the jump from the first large box to the third is 2/3 of 150 or 2/3 of 150, which would make the rate between these 2 points 100, as 100 is 2/3 of 150. This continues with 3/4 of 100 for the next box, making it 75, and then 4/5 of the 75 heart rate for the next box, which comes out to 60. This pattern continues on. And keep in mind that you don't just have to jump from big box to big box. We're talking about 5 little boxes or 0.20 seconds. Next, let's discuss rhythm. The rhythm of an EKG refers to the regularity of the QRS complexes. A regular rhythm means that the QRS complexes occur at regular time intervals, while an irregular rhythm means that the QRS complexes do not occur at regular time intervals. A normal rhythm for adults is called a regular rhythm. However, an irregular rhythm can indicate an arrhythmia, which is an abnormal heart rhythm. Some examples of arrhythmias include atrial fibrillation and ventricular tachycardia. Quick ways to determine regularity include counting the approximate number of large or small boxes between each QRS complex and making sure that they have roughly the same amount between each beat. Others will place a separate sheet of paper over the EKG and just leave the QRS complexes peeking out from behind that paper. They will make marks on 2 overlying QRS complexes, and then they will use that as a set of calipers to make sure that all of the QRS complexes are spaced out evenly. Additionally, it's not seen very much, but some physicians will actually use calipers for this same purpose. And if they do have calipers on hand, it is a very efficient method. Finally, let's discuss axis for a little bit. The axis refers to the direction of the electrical activity in the heart. That is, the direction in which the depolarization wave travels. The normal axis for adults is between -30 and +90 degrees, with 0 degrees being directly to the right on a circle, seen on the diagram in the slides. The EKG can be divided into 3 main limb leads, leads 1, 2, and 3, and 3 augmented leads, leads AVL, AVF, and AVR. The heart's electrical activity is measured by these leads and analyzed to determine the axis. An abnormal axis can indicate a problem with the heart's electrical system. Determining the axis of an EKG tracing involves analyzing the electrical activity of the heart as measured by leads 1, 2, and AVF. If you remember from prior lectures, each lead looks at the heart from a different point of view. What was not stated at that time is that each of these viewpoints of the limb leads, as well as the augmented leads, are associated with degrees of a circle, shown on the slides now. We will only be discussing leads 1, 2, and AVF as they are the ones that we need to use to determine whether or not the axis of an EKG is normal. Remember that a normal axis is between -30 and +90 degrees. So we will combine the knowledge of what degrees are associated with positive and negative deflections in leads 1, 2, and AVF to help us deduce whether or not the axis is within normal limits. Keep in mind that when we talk about deflections for the rest of this lecture, we are specifically referring to the QRS complex. First, let's look at lead 1. Lead 1 is positive if the axis falls in the right half of this circle that, generally speaking, is representing our heart. It is positive from -90 to +90 degrees. If lead 1 is negative, we know that we are already out of a normal axis range and that we are looking at what is called either right axis deviation or extreme axis deviation, as both of these areas fall on the negative half of the circle that is being displayed currently. Next, we check out lead AVF. A positive deflection in AVF represents that the axis is between 0 and 180 degrees, which is the bottom half of the circle as we are looking at it. With a positive deflection in AVF, we know that the axis is between those two areas. If the QRS deflection in AVF were negative, we would know that the axis falls somewhere outside of 0 and -180 degrees, or on the top half of this circle shown on the slides. Last, we'll look at lead 2 before covering a few scenarios and applying this knowledge. Lead 2 is considered positive between -30 degrees and +150 degrees. Therefore, a positive deflection in lead 2 tells us that the axis is within that range. Combining what we know about leads 1, leads AVF, and leads 2, we can determine the overall axis of any EKG. Let's examine a few scenarios to bring it all together. In the first scenario, lead 1 is positive, so we can eliminate the left half of the circle. Lead AVF is also positive, so we can eliminate the top half of the circle. This leaves us between 0 and +90 degrees, which is normal axis. But let's look at lead 2 just to confirm. In this first scenario, lead 2 is also positive. The area between 0 and +90 degrees is the only area that meets all of these criteria, and so the axis in this scenario is normal. In our next scenario, lead 1 is positive, so we know that we can rule out the left half of the circle. Lead AVF, however, is negative, which means that we are looking at an area between 0 and -90 degrees. In this scenario, that is scenario number 2 still, lead 2 is negative, meaning that the only area satisfying the criteria of all 3 leads falls between -30 and -90 degrees. That means that in this scenario there is left axis deviation. In our third scenario, lead 1 is positive, so we know that we can rule out the left half of the circle. Lead AVF is negative, which means that we are looking at an area between 0 and negative 90 degrees again. In this scenario, however, lead 2 is positive, meaning that the only area satisfying the criteria of all three leads falls between 0 and negative 30 degrees. This area is still considered normal axis, but could indicate hypertrophy in a patient whose axis on previous EKG readings was between 0 and positive 90 degrees. Additionally, this pattern is sometimes seen in chronically trained athletes. In our fourth scenario, lead 1 is negative, so we know that we can rule out the right half of the circle. Lead AVF, however, is positive, which means that we are looking at an area between positive 90 and 180 degrees, which can only be right axis deviation. Lead 2 is either positive or negative in this scenario. A negative deflection in lead 2 would signify greater deviation, as it would indicate that the axis was between 150 and 180 degrees rather than between 90 and 150 degrees. In our fifth scenario, lead 1 is negative, so we know that we can rule out the right half of the circle. Lead AVF is also negative, which means that we are looking at an area between negative 90 and positive 180 degrees, which can only be extreme axis deviation. Lead 2 is always negative in this scenario. In our final scenario, all of the leads are biphasic or equiphasic. Additionally, the combination of leads 1 and AVF could indicate that the axis is within a certain area, but lead 2 indicates that the axis is somewhere else. In these scenarios, it is probably best to check all of your lead placements to ensure that they are placed in the correct position on the patient's body and to ensure that they are all connected properly to the EKG machine. Here is a table summarizing the various combinations. It is not enough to simply memorize this table. You should understand the principles that we have talked about in this video in order to truly master this concept in EKG interpretation. In summary, the rate, rhythm, and axis are all important components of an EKG. The rate is the number of heartbeats per minute, the rhythm is the regularity of the QRS complexes, and the axis is the direction of the electrical activity in the heart. An abnormal rate, rhythm, or axis can indicate a problem with the heart's electrical system. It is important to note that each small box on an EKG represents 0.04 seconds and each large box represents 0.20 seconds, which helps to interpret the duration of the QRS complex and the PR interval. Thanks for tuning in, and please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education resources to students around the world.